In the past 40 years, all the cardiology community, all of us have been believing in either exercise treadmill test or stress thallium or SPECT myocardial perfusion test to make a diagnosis of the presence of coronary artery disease and also to predict the extent of ischemia based on which whether the patient needs to be subjected for bypass surgery or stent implantation or only the patient will do well with medical management. So, in other words, the SPECT myocardial perfusion or stress tests are considered as gold standards to predict the prognosis of the future occurrence of ASCVD events, and also the right line of management was based on the decision on that was based on the stress test. Now, we know that the stress test is not the first line of investigation. It is a CT angiogram which gives the anatomical disease, presence of the disease, and many people who have no disease, no calcium, no atherosclerotic plaque have positive stress test, which is called as a false positive stress test. Similarly, when 2-3 vessels are also narrowed or blocked, not uncommonly the stress tests show negativity, which is called a false negative test. So, now the concept has changed to be more precise, to identify the people with the disease who were considered to be low risk. Now, we know we are able to pick up, yes, no, these are not low risk, these are the people who are likely to develop. The other people, like people who have hypertension, diabetes, whom we are considering very high risk, not all people are at high risk. If they have calcium of 0, if there is no atherosclerotic plaque, their chances of developing future heart attacks are much less. In fact, we were considering diabetes as a very dreaded disease wherein anytime they can have heart disease. It is not true. Only a certain segment of the diabetic patients, roughly around 40%, 50% have higher propensity to develop ASCVD events or coronary events, whereas 50% are immune. Many patients are diabetics with 20-30 years, they do not develop any disease. That means they have a protective gene which protects them from developing this atherosclerotic plaques.